So, another gastrointestinal disease that we will discuss is IBS or irritable bowel syndrome. This is typically alternating diarrhea and constipation. Clients typically have symptoms like abdominal pain, bloating, gas, and nausea. And usually, for a diagnosis, we see this happening 3 times a week over the course of 3 months. Um, Look at the wording here may benefit from. IBS is just so um, nondescript with so many different people. Like some people have different symptoms than others, so there really isn't a one size fits all. So you may want to work with your clients then to try these things to see if they improve their symptoms, also maintaining adequate fluids. One piece that is on the horizon for um, treatment of IBS is something called the FODMAP diet. And the FODMAP diet stands for um, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, so as you can see, this is a pretty extensive list here, and it requires a client that has a high level of motivation, and it requires working pretty closely with a nutrition professional. So what's going to happen is someone following a FODMAP diet is going to avoid these foods, which when you look at this list, you're like, hey, I thought all this stuff was pretty healthy. But we're just trying to see which area is giving them the problem. So they're going to avoid these foods and then gradually add one of these groups back. And when they get the symptoms back, then they'll know that, hey, it was the polyols that was causing my symptoms, or it was a high lactose. So you can see here the fermentable oligosaccharides, disaccharides, monosaccharides, and polyol, the FODMAP diet. Sorry, trying to get here. Yep. Um, what those foods are doing, high lactose is creating gas and pulling water into the guts. Excess fructose is also pulling water into the guts, causing diarrhea. High fructans creating gas, and then high polyols pulls water into the gut. So this handout and more information on the FODMAP diet you can find in Blackboard under weeks 5, 6, 7, 8, and 9, and then you'll go to the GI MNT handouts and video links. This is also, I'm just going to preface our IDSI information here for the dysphagia diet that we talked about before. Here's also an interesting video on Crohn's and ulcerative colitis, which will be the next slide that we're chatting about. So inflammatory bowel disease is different from irritable bowel syndrome. Inflammatory bowel disease is much more severe. There are 2 types, Crohn's disease and ulcerative colitis. And I want you to look at that video that I have posted in Blackboard because they do a nice job of differentiating between the 2 conditions. Although they have similar symptoms, diarrhea, abdominal pain, fatigue, malabsorption, weight loss, there are many differences as well. For instance, Crohn's disease is inflammation of the intestinal tract, the entire intestinal tract. So we can see a flare-up anywhere from the mouth to the anus. Contrast that with ulcerative colitis. This is only happening in the colon, so it's only happening in the large intestine. So for a treatment for ulcerative colitis in a severe form would maybe be to take out the section of the colon that is inflamed and ulcered. If we did that with Crohn's, those ulcers could pop up somewhere either further down the GI tract or above that area on the GI tract. So you see, I'm not trying to lessen anyone's severity of ulcerative colitis, but this is just limited to one area of our GI tract where that Crohn's disease can pop up just about anywhere. One thing with these lesions is they can become so severe that they could go through the